I'm Renee Poh reporting to you live from the College of Medicine building at the Ministry of Health. The Health Ministry has just confirmed one new case of coronavirus today.
As of noon today, 24th of February, the Ministry of Health has confirmed and verified one more new case of COVID-19 infection in Singapore. This brings the total to date to 90 cases. The new case is linked to the cluster at the Life Church and Missions, Singapore. We're continuing our epidemiological investigations on the local clusters identified earlier, as well as to identify links between cases. Contact tracing is also underway.
The Health Ministry has also announced that 2 more cases have been discharged from hospital. And in all, 53 patients have fully recovered and have been discharged. Of those who remain in hospital, most are in stable condition, but 7 are in critical condition. I'm now joined by journalist Timothy Goh, who has been covering the latest developments on the coronavirus outbreak. Hi, Tim. So let's talk about the latest case, case 90, the 75-year-old woman. What can you tell us about her?
Well, as you mentioned, she's a 75-year-old woman. She's a Singaporean citizen, and she has links to the Singapore, the Life Church and Missions cluster of cases. What we know is that she developed symptoms on February 9th and then went to see a doctor immediately after that. Her symptoms continued to develop, so she went back again on February 17th and 23rd. And on the 23rd of February, the doctor decided to call an ambulance and send her to Tan Tock Seng Hospital's emergency department. So she's now currently isolated at NCID.
And more details have also emerged about case 89, the previous case, which was one of 3 new cases on Saturday. So what can you tell us about that case?
So if you remember correctly, case 89 is actually the case who went to the gym at Bishan Community Club, and the gym was closed afterwards. It turns out that he is also the Filipino case that the Philippines embassy posted about on Facebook earlier, and so the embassy has not revealed many more details about him. But what we do know from his history is that he was a funds manager, and that he is basically a Singapore permanent resident.
And there have also been reports overseas of patients who have been discharged, but then after that they test positive for the virus again. So what is Singapore doing to combat this?
So I can understand that a lot of people are concerned about this. Singapore's system is really quite robust. What we do is that we do test patients who are to be discharged twice over 2 consecutive days to ensure that they are free from any traces of the virus. If the virus is detected, they have to redo the testing and may need to stay in hospital for a longer period of time. Now this is a very robust and safe system as compared to in other places where resources may be stretched a little thin and they don't have the capability to test patients so many times, which may be what is resulting in these reinfection cases of people who are supposed to be free from the virus.
Thanks so much, Tim, for updating us. And that was journalist Timothy Goh, who has been covering the latest developments on the coronavirus outbreak. I'm Renee Poh reporting for The Straits Times.